What about patients who have immediate placement? And as I said, this can be such a useful tool to help determine the implant stability. And so this a patient was part of our study, the same study where we looked at both delayed versus immediate placement. And this patient was randomized to immediate placement. And this is going to be in her upper right second premolar that is going to be extracted. And you can see that we have very nice amount of bone around the implant and a sinus that's not very pneumatized on this right side. And so you can see after the tooth is extracted, we have a really nice site to be able to place our implant. Implant placement is 67. Now, of course, most of the stability, as you can imagine, is coming from the apical bone, because we had good bone on the apical area, which I was very happy about, because you can see both on the buccal and the palatal, we don't have a lot of bone support here. And so, certainly with this reading, it gives confidence to place the immediate implant, but not necessarily to load it primarily. Now, you could do immediate loading, but being the conservative person that I am in terms of loading protocols, I was glad that the study did not call for immediate loading. The immediate placement was quite enough for me, and the confidence really I gained by looking at the ISQ value in this case. And so you can see, of course, we're grafting around that implant because there was quite a large defect there. And then the patient goes on to heal. This is a collagen plug placed over the crestal surface. This is healing after a week, and so you can see here that she healed fairly well. She was not a smoker or a diabetic. She was in her 60s, I believe, at the time. This study called for indexing, so this is conventional analog indexing and placement of our restoration. You can see at the time of loading, the patient's ISQ value had increased to 75, again, giving good confidence that we have very nice osseointegration and transition from the primary or mechanical stability to the secondary or biologic stability. And then you can see this is our implant at the time of the provisional delivery. This is the provisional restoration that was delivered after 3 months of healing. The patient here, and you can see in this second premolar on the right upper. This is after about 6 months. You can see here that we have nice screw-retained restoration. This is our patient after 2 years. So we're getting cone beam CT scans in the study annually to look at the bone maintenance on the buccal aspect, which is really, really important in terms of long-term maintenance of implants and aesthetics and function. And this is her after 4 years with her restoration. This is the crown, periapical radiograph, and cone beam CT scan, again showing really stable bone on the cone beam. And certainly we're not going to be taking cone beam CT scans every year to make sure that we have good buccal bone, but the study has been really enlightening in terms of looking at that stability to really make sure, especially in implants that are immediately placed, do we have that buccal bone stability on that around the implant and its ability to maintain both long-term function and aesthetics for those implants.